I'm an otolaryngologist, fancy words for an ear, nose, and throat surgeon. I am 64 and still actively in practice. My diagnosis was based on a PSA that went up from 2 to 5 and a prostate biopsy that did show a low-grade prostate cancer. I have a blood disorder, and so as a result I couldn't have surgery. My Cyberknife treatment included 5 treatments on a 3 days 1 week, 2 days the next week, and so basically in just over a week and a half I was done.
Cyberknife is a ultra-precise form of radiation therapy. The machine is unique in that it's driven by computer software, and so it's able to do things that a conventional machine can't do. Well, we're getting the same results with this that we were getting with the other machines. The traditional machines, the standard therapy, we get the same cure rate, sometimes better, because we're able to treat areas and cause less side effects. So for instance, you have a prostate tumor, instead of damaging the rectum or the bladder or the femur bones, you can treat just the prostate without causing too much damage. For prostate cancer, we give 5 treatments. You don't feel it, you don't hear it. You just lay on a table, it starts, it stops, it's over.
For treatments, I worked a half day. At the end of the half day, I drove myself to the treatment. You have to lay there on the table for probably an hour and try not to move. I discovered that if I was careful, I could fall asleep during the treatments, and then got up and drove myself home.
When I found out I had cancer, the first thing I wanted to do is see how to go about treating it and get hooked up with the right doctors to do the job.
And no pain.
No pain whatsoever.
The START Center for Cancer Care is a multidisciplinary clinic which offers all forms of treatment for cancer, i.e. surgery, radiation, chemotherapy, experimental therapy. We're the only machine south of Austin to the border. We have patients come in from Del Rio, down along the border, Laredo, McAllen, Brownsville, that all come up here.
We have a full family ranch, so we have lots of stuff to do in a day. It looked like a good option for me because of the distance I had to travel. We had an 80-mile trip. The other one, I would have had to make that 80-mile trip 45 times.
So it's short course versus long course. There's no difference in the radiation between conventional radiation and the Cyberknife radiation. It's the way it's delivered.
I arranged to have the treatment done in the afternoon, and in the morning I saw patients as I usually do and didn't really miss any days in the office from the treatment. My radiation therapist told me that some people feel tired, and I felt tired. I would go home at the end of a treatment and take a nap. And for probably a week or so after the treatment, I was tireder than normal for me, but basically didn't feel anything at all. And given a choice between 5 days of Cyberknife and 40 days of traditional therapy, it was a pretty easy decision.
The process for me was not painful at all. I would recommend this to any man that was diagnosed with prostate cancer. Everybody here was great, made the difference.